Hi Megan, this is me submitting my video for the final evaluation for our rural practicum. Tristan Dukeshire is my name. So to answer the first question here, did you feel well prepared for the rural focus? Why or why not? How could you have felt more prepared? So coming into the rural focus, I felt pretty prepared. I previously undergraded on 5 West over the summer between my between my third and fourth year. So I felt that I was able to build those foundational skills like time management and kind of all that, nursing patient care, all that stuff. So I felt that coming into this year, I had a pretty solid foundation that I could build upon and kind of expand my skills. And then going through the rural class of nursing 551 helped me feel even more prepared, just because I was able to learn a lot of those really strong skills that are required by nurses that I wasn't familiar with before, like the CTAS scores, primary surveys we had gone through quite a bit, but even the secondary surveys, just kind of understanding how all of those went through. And then we also were able to cover a lot of acute problems that are encountered in rural areas and kind of the presenting signs and symptoms and the interventions that are necessary for that through that one PowerPoint we did in class. So I feel that really helped prepare me as well, just as a good refresher from patho and pharmacology. And then we were also able to go through ECGs, which I found to be a huge benefit in my placement. We really haven't gotten to go through ECGs before in any classes. So I really enjoyed that we were kind of able to go into depth about like atrial flutter, AFib, kind of all those different like heart, all the different heart blocks, first degree, second degree type 1, second degree type 2. I felt that was really beneficial because I haven't really been exposed to that before. And through my rural practicum here, I felt that it was a great benefit as I got to look at a couple different ECGs with different patients coming in with chest pain. The only thing that I felt that would have helped me be more prepared was kind of a walkthrough of a ACLS type course and seeing a nurse kind of walking us through a code. I just feel I still haven't been able to witness a code or kind of be a part of a code. So I was able to look at like the ACLS pathways and kind of the different ones for Tachy and Brady and NSTEMI and all of that. But just kind of being able to see that in action, I feel would have been a really good benefit prior to coming out here, and I still feel it would be a good benefit for me since I haven't been exposed to that. Your second question here, what went well in your rural practicum placement? What was the greatest learning event / situation that took place? So what went well in my practicum was I feel that I was able to ask for clarification anytime I was unsure of something and ask relative questions to enhance my learning. Just like if me and my preceptor were doing something and I had a question about it, she was always willing to answer and kind of enhance my knowledge and kind of my understanding of that situation. I felt that all my assessments were done competently and thoroughly, and it helped provide me, my preceptor, and the physicians a good clinical picture of the patient and kind of acutely what was happening at them at that moment. The event that provided me with the greatest learning was when a patient came in via EMS with a query CVA. This was really good as I haven't seen any neurological incidents like that. So I was able to learn the Cincinnati stroke screen, and I know the presenting symptoms of a stroke, but it was very interesting to be able to see that firsthand, kind of the facial droop, that left or right, mostly left-sided weakness, kind of the slurred speech, all of those textbook CVA symptoms, but it was really interesting to see in real life. And then it was also interesting to learn through that situation and through the ACLS kind of pathways that my preceptor walked me through about initiating fibrolytic therapy, like we know TPA and TKN and kind of those clot busters, but she was really able to go into depth of how important a head CT was before starting any of those to differentiate between a hemorrhagic and a non-hemorrhagic, and just how devastating that could be if someone were to make that mistake and initiate before they were certain of which type of stroke it was. To answer your third question, what was the greatest challenge in the Rule of Focus? What did you learn from this challenge? So the greatest challenge I found while being in my Rule Practicum was really the lack of diagnostic tools and resources that we had out in Oyen. So I know that's been talked about a lot in rural classes and even our other classes, kind of that resource disparity between rural and urban centers. But kind of learning it in class and seeing it in the clinical picture was quite disheartening to see. Like, I found that there was a lot of wasted resources. Like, we have one EMS team and 2 ambulances out here, and I found that EMS spent more time transferring yellow patients to Medicine Hat for a head CT or an abdominal CT than they did actually bringing patients with acute problems to us. So I feel like that was the biggest challenge we encountered, is just not being able to get that full clinical picture like we wanted to. And then, so yeah, the biggest thing I learned from that was the big health inequities and how we need to advocate for more rural spending, especially to help with some of that health inequities that we have out here. For your fourth question, did you feel supported by your mentor and faculty advisor? What could have been done differently if not? So throughout this semester, everyone's been amazing. I felt extremely supported by my mentor, my 2 mentors, and my other staff at the facility. They were always willing to answer questions, and they would walk me through anything I was unsure of. They were also really good at letting me practice my skills. We had lots of patients come in with like an infection or whatever, and they would always be certain to let me practice putting the IV. They would save the dressing changes for me. They would save the catheters for me. They were really good at letting me practice my skills, and they were also able to take some of those more mundane tasks like handing out medications and all that. They were willing to undertake that while we had something in Emerge, so I was able to kind of go do that assessment or kind of learn an advanced assessment or learn a new system assessment like the HENT system and all of that. They were willing to do that, so I was able to further my education, which I found was fantastic. But there was really nothing I would have had them change. Number 5, how has this experience impacted your nursing practice going forward into final preceptorship and beyond? This experience has impacted me in an extremely positive way. I've gained a significant amount of confidence and competence being out here, and I understand a much greater depth of acute medical care and kind of how to work in an emergency room and kind of all the different things that impact that. And all the knowledge and experience I was able to gain in the short 186 hours I've been out here will be carried with me throughout my career in a positive manner. And it will really help to further my ability to be a competent nurse. And I appreciate everyone for helping me with that. So that's all for the questions. And just the one other thing I have was just with the Thanksgiving being 8 hours that we got, I have it on our clinical weekly schedule, like that Excel, or not Excel, but that Google Doc that you have us all in. I have the days that I stayed late, but there was 4 different shifts that I stayed approximately an hour late for. Like one day was 45 minutes, one day was an hour and a half, kind of just like that there was kind of stuff going on and learning opportunities that I stayed late to take part of. So I just wanted to let you know of why there would be on there that said like I stayed an hour late or whatever, just to make up those last 4 hours that we had from that Thanksgiving shift and me doing 12s. But otherwise, thank you.